babbling too much. Keep it timely.
Well, why we've got, a couple of minutes here.
Yeah.
Tell us a little bit about Ortho Molecular, the company.
Okay. So I'll explain some of that when we do start the presentation, but we're a Midwest company. We've been going for 32 years now. The Midwest is where we kind of started. Manufacturing plant is in Wisconsin. Corporate headquarters is right across the border in Illinois. We've always made our own supplements. We are a manufacturer. That's something we've always prided ourselves on. And Michigan was one of kind of the original territories. And I mean, obviously now we're all over the country. We have a distribution center in California, one being developed down in the southern region as well. We just moved into to Canada as well. So our Canadian territory is about a few years old. And then in the next few years, we'll be in Europe as well. So starting to expand more, but the Midwest is kind of where we were born and raised and kind of the bread and butter for us.
And your only manufacturing facility is in Wisconsin?
Yes, yes. We just tripled the size. We like to keep that all there. Just makes it easier for lab testing, because everything that comes in and out is all lab tested. So to have all the manufacturing where the lab is.
Well, and that's good to hear that everything's manufactured here in the United States.
You got it.
The standards are very high.
Yes, yes.
And I would
We're actually going. Oh, go ahead. Sorry.
I would imagine that you have to follow the same manufacturing standards that the pharmaceutical industry has to follow.
Exactly. They're actually a little more tough, a little known fact there. We have a couple things we have to do that makes it quite difficult, but we're able to do it. And we're actually trying to compete for the Malcolm Baldrige Award. That's a 8-year plan, but it's an award that goes to one of the best manufacturing companies within the United States. So something we are competing for, and one of our goals.
No, that's awesome to hear.
Yes.
Awesome to hear. Well, I'm glad that we got connected with your company so long ago. It's been a very good relationship for our patients and for us personally. I use all of your products. So I don't use all of your products, but all the products I use are your products. That sounds better.
Yes, there you go.
Okay, well,
it's
10:30 now, and we're going to go ahead and get started here. I see that we have several guests on the line, and I'd like to introduce Matt Daratony. And Matt works for Ortho Molecular Products, OMP, out of Wisconsin. We have worked with Ortho Molecular for the last 12 or 13 years, and Matt is our account executive. He's the one that we come to for advice. If he can't answer the question, he has people that he can ask the question of. And we've been with them long enough where their executive vice president for Ortho Molecular, Nate, used to be our account executive. So we've learned and grown a lot with Ortho Molecular over the years. Matt here is a graduate in the pre-med program from University of Michigan. You can see the little block M over his left shoulder there. And he played a lot of sports. And he says he has a passion for nutrition and getting good supplements and to help people out. And he loves his job as the rep for the entire eastern side of the state of Michigan. So I'd like to introduce Matt Daratony. Go ahead, Matt.
Yeah, well, thank you very much, Dr. Shu. And Dr. Shu does have a great office. He's been working with us, like you said, a long time. Definitely knows what he's doing with Ortho Molecular. And I'm excited to be here today, get to talk to you guys a little more about ortho. And let me just pull up my screen real quick here, and we can get started. You guys able to see that okay, Dr. Shu?
Yes, yep, I can see it.
All right, perfect. So Ortho Molecular, let's take an inside look about kind of who we are, some of the products, some of the things we are able to help, some of the big topics going on right now, and see if we can learn something. So start with any company is the core values. Me and Dr. Shu were just talking a little bit before we started here about kind of who Ortho is, kind of how we've developed and how we're doing over the years. And one thing we stay true to is the core values that we built our company on. And this is something we want to make sure we continue on to be a successful company. And so what are those things? And one of the main things we are always looking for is raw material quality. Might sound kind of gimmicky to start, but certain things, whether it's botanicals, certain vitamins, the fish for the fish oils, certain things are going to be better in certain parts of the world. We're always looking for the purest product, the highest quality, and where we can get those things from. We do manufacture all in the United States, up in Wisconsin, but we do get our raw materials all over the world, because certain things are going to be better from different parts of the world. Certain botanicals are going to grow better. And so that is something we're always striving for. This stuff is always changing, so we always have to stay on top of it to be changing the formulations and kind of what we do with some of our products. The example I have here is with Ortho Mega. This is the fish oil that we use. And the big thing to pay attention there is the form that the fish oil is in. Can you guys see my mouse, Dr. Shu?
Yep, we can see your mouse.
All right, perfect.
And Matt, before you finish with this slide, there's something I'd like to say at the end of this slide.
Okay, yeah, no problem. Which we will be getting more into Ortho Mega later, but I do want to make the point that when talking about fish oils, there's two different ways you can manufacture a fish oil. One is in the triglyceride form, and the other is in the ethyl ester form. The ethyl ester form is cheaper, easier, and it takes less time to manufacture, but it is not as great as the triglyceride form. This is a natural form. It's going to absorb better, and it's going to work better within the body. So this is why we choose to go with the triglyceride form. It is more expensive. It is a little bit harder to do, but the efficacy is better, and that is really what we're looking for. Most other fish oils that you'll find out on the market are in the ethyl ester form, and we don't want to have we want to have the better product, basically. Did you have something on that, Dr. Shu?
Yes, Matt. And I just wanted to reach out to our audience and our patients and let them know that the reason we're with Ortho Molecular is because of the ingredients. And we know that the difference between pharmaceutical grade supplements, which what yours are, and nutraceutical grade supplements, which are what you can buy in the general population or at the major stores, is the ingredients. And the ingredients make all the difference in the world. So thank you, Matt.
Yes, no problem. And we'll talk about that more about that as we go along with the presentation as well. So here's another example, which is the therapeutic dosing. This is another very important thing. We want our products to do something. We want them to be effective within whatever you are using them for. And in order for that to happen, we have to have certain amounts of things within our product and the right type of thing. So here's an example here. Here's a line. This is the #1 retail selling probiotic. And if you can read this down here, it contains 1 billion CFUs of bacteria. Then you go to Ortho Molecular over here, and we have 20 billion, 7 different strains, and Saccharomyces, we have 3 billion now, that says 2. But why is there a difference there? And what we take it back to is the literature. So on the right side here is some clinical trials done to find the effective dose that you need for probiotic, basically. And we know from lots of clinical trial that we need around the 20 billion mark to be effective for whatever you're using the probiotic. And we'll talk about that more later too. But comparing the two, the Align may not be as therapeutic as maybe you want with the Ortho version of it.
And Matt, will you talk about the Pro 225 at the same time?
Yes. So I actually have another slide later when we do talk about orthobiotic, but we do have other products as well. So we have, this is the standard 20 billion. Then we have the 100 as well as the 225, which are going to be 225 billion colony forming units, which is going to be a more aggressive formulation to help with more the harder GI disorders or whatever you're looking at there, which we'll dive into more on that as well. So to summarize, what is the ortho difference? Well, one is the scientific research. You'll hear me talk about this more too, but we are all about the research. We want clinical trials done with the ingredients we're putting into our products, and even some of our products have been put to clinical trial. So we want the research to be there. We want to know that these products are actually going to do something. The high quality raw ingredients, of course, we just talked about that. We're always looking for the best and the better, and the therapeutic potency. So one example I'll leave you with on kind of this topic is the topic of CBD. And I know this has been the craze lately, and Ortho does not offer anything to do with the CBD. And why is that? Because we have seen people respond awesome to CBD, which is great if it's helping people. That's that's the goal. But why don't we have a product with the CBD? And that goes back to the scientific research. We don't have enough evidence to know exactly how to formulate it, exactly how to dose it, where exactly to get it from to make the best possible product. We know it might work, but we just haven't seen enough of the research, enough of the clinical trials to see something that we would be confident in manufacturing. So if that does ever come true, yes, we'll make a product, but as of now, we are not going to jump on the bandwagon just because people are liking the product. We're going to wait till we have the evidence base. So that's Ortho for you. Then one more important thing is we are not for sale on Amazon. This is very, very important. I actually have a bottle right here. It actually says on the bottles, somewhere, I don't know if you guys can see that at all, but it says not for sale on Amazon. This is a professional grade. So there's a couple reasons for that, but the main thing is if you see our product on Amazon, do not purchase that. That is not a legal product, and it's most likely expired, not kept in the right conditions, as well as could be tampered with. So we have a team that goes on Amazon because sometimes the products make it on there, and we buy back our own product, find where it came from, and we do not want it on there. Usually when we buy it back, there's something wrong with it. Usually the barcodes are all scratched off, and not good things are happening there. So you can go to Dr. Shu to get your supplements. Dr. Shu kind of knows what his patients need, and he'll be the best person to recommend what to use with Ortho. Very important there. So let's get into a couple things. So there's Ortho for you, kind of what we're about, what we were built on. So where can we help? And the first thing I want to talk about is osteoporosis. So I know a lot of conversation now is around immune. There's all kinds of things going on in our world, but bone health is important still. Not the time to be fracturing your bones. And so where does this osteoporosis come from? Well, main thing to look at is menopause, certain medications, exercise, could be just things with lifestyle, sometimes environmental, diet is going to lead to osteoporosis and bone density issues. So what can we do with that? But before we realize what we can do with the bone density, we have to understand kind of what's going on with the bones. I know this can be a little bit confusing there, but there's just a couple points I want to make about this. So if you take your skin and you rub your skin really hard, there's going to be some dead skin cells coming off, right? This is totally normal and this is fine. Now think about your bone. Your bones is not a hard thing sitting inside your body that just kind of holds you up. It's actually living tissue. And so the same concept with rubbing the skin and the skin cells come off, same thing is helping with the bone. There's a layer or certain areas where cells are dying off and we need to replace those. So the main things here are the osteoclasts and the osteoblasts. These are the things that go to work to replace that bone. And I know that can be a little bit confusing, so I'll put it in kind of Michigan terms. Think of your asphalt roads. Over time, the asphalt roads, they get these weak spots, and eventually they're going to form potholes. Nobody likes potholes, not good for your car or anything like that. But think of that like your bone. So over time, you're going to get this weak spot in your bone, and the osteoclast is going to come to take out that weak spot. So now you have a hole. Well, we got to patch the hole. And so that's what I'm kind of picturing here with the construction workers. So you get the trucks going down the side of the road, and they're taking the asphalt, putting it in the potholes, and patching up the potholes. Now we know that always doesn't happen in a timely fashion, but when it does happen, that's when you fix the hole. And that's what we're looking at with the osteoblasts. So the osteoblast is going to patch the hole of the bone and create the new bone. And this is healthy. This is what we want. We want to get rid of the old broken down and relay the new bone. But unfortunately, over time, that process isn't going to work as well, whether it's from just age, diet, lifestyle. Certain things are going to lead to the osteoblast and the osteoclast not working as well. And so this is when we like to look at the chart here. This is a bone density chart, male and female. So unfortunately, due to menopause, female tend to have more breakdown of bone density due to some of the hormonal imbalances. But we have these 3 different stages. So the green is the foundation. So this is bone density is good, but we want to maintain it and make sure the bone's good to go, so we don't end up into yellow, which is the osteopenia, and the purple pink, which is your osteoporosis. So what can we do for this? So we're going to start in the green here with the foundational. And certain nutrients are going to help with the bones, of course. On the bottom here, you've probably heard for a long time, calcium is going to build strong bones, which that is still very, very true. So one of the ingredients we're going to use is calcium. We need vitamin D. So vitamin D does all kinds of things in the body, which we're going to talk more about vitamin D later. But one of the things it does help with is bone density. So you need your healthy levels of vitamin D. And it's actually, especially because we live in Michigan and we don't see sun for half the year, most people are deficient on vitamin D. It's just kind of a fact of life. Magnesium is going to help with the osteoclast and the osteoblast. It's going to support them and to help with bone density. 60% of the population is deficient on magnesium as well. And vitamin K. This is a big one that people don't usually think about. And I just want to talk really quick about vitamin K because it is very, very important to bone health overall. So think of your bone. So you have your bone here, and on the bone is this little receptor that grabs the calcium. This is called osteocalcin. So osteocalcin is on the bone and looking around for calcium. It's going to grab the calcium, bring it into the bone. This is important because obviously we need to get the calcium into the bone to create the strong bones. But this osteocalcin, that's the grabber, is not active unless vitamin K is present. So when there's no vitamin K, this grabber can't grab the calcium and it can't get anything into the bone. So that's going to cause a lot of bone density issues when that vitamin K is not present and we're deficient in our vitamin K. And just another little thing about that is when the calcium isn't able to get into the bone, well, it's got to go somewhere. So typically what we see is that when it can't get into the bone, it's going to bounce off and end up in the arteries. That's why you see a lot of issues with calcification of the arteries and going to lead to cardiovascular risk. So vitamin K is very, very important for bones and for cardiovascular risk. And people don't usually realize that.
Hey, Matt.
Yeah.
When we take x-rays of patients, we do see times where people have a lot of extra calcium in their rib cage, in the cartilage of the rib cage, in the cartilage of their throat, in areas where we shouldn't see calcium. Do you think that's evidence of a vitamin K deficiency?
Correct. Definitely, actually. Because most of your calcium in your body is going to end up in the bones, but you need that vitamin K. You need to get it in there, and it's got to go somewhere when it can't get into the bones. So
and
yeah, that's most likely
vitamin K with your vitamin D product, right?
Correct. Yep. So vitamin D is going to help to get calcium into the body, plays a major role in that. Then the vitamin K is going to help to get the calcium into the bone. So that's why they kind of work hand in hand with the K and the D. You need to get into the body, then into the bone. It's kind of the two-step process there with the K and D. So what's our foundational product? That's going to be OsteoBase. So this is everything we just talked about. It's got the calcium and phosphorus, 2 important pieces to bone building. It's got your vitamin D, it's got your magnesium, and it's got your vitamin K2. I know we talked about vitamin K. So there's 2 forms of vitamin K, K1 and K2. Both are natural compounds. K1 you usually get from leafy greens. K2 you usually get from nattokinase. I know a lot of people aren't running around eating natto these days, so vitamin K2 is not as common, but vitamin K2 is actually going to last longer in the blood than vitamin K1. So you're going to get that the grabber is going to last longer with vitamin K2 rather than K1. And so that's osteobase. So this is where you want to maintain healthy bone. You want to make sure you don't go down the road of bone density issues.
And Matt, what is the product ingredient amount in this osteobase versus the standard K2D3 that you market?
Yeah, so K2D3 has the same amount of K2, but in the K2D3 product, vitamin D is going to be a little bit greater. So this one has it has 1,000 IUs. I don't know if that's easy to read or not. And then K has the 45.
So why would someone take this product, Osteobase, as opposed to the K2D3?
So that's a good question. If you want a little bit more support, so this gives a little bit more. This gives the calcium and the magnesium, as well as the D and the K. You can take D and K for immune health as well, which we're going to talk about because it's got more of the vitamin D. So it's just kind of the application of if you want more support. So if bone density isn't looking good and we really want to go after it, go a little more aggressive with the osteobase. But if you're healthy, bone density is doing good, maybe you don't need all of the support. You could go with the just the D and K.
Got it. I understand. Great. Thank you.
Perfect. No problem. So now let's get into the yellow portion here. So bone density is starting to go down a little bit. You're no longer in the healthy area, and we need some additional support. So that's when we bring in the specialized nutrients. So we have all of the micronutrients we just talked about. It's going to help with the bone, but there's certain things we can use going back to the osteoblast and the osteoclast, patching the potholes. That is actually going to support that a lot more. Things like the strontium, boron, and the ipoflavone. So our next product, and once again, this is for the yellow section, the osteopenia section, is OsteoPrev. So OsteoPrev, it's going to have everything that Osteobase had in it, but this one's going to be a little more potent. So we see vitamin K, we actually have K1 and K2 in here, a little higher concentrations. D is going to be the same, but we have calcium, magnesium, then we have the addition of other trace minerals. It's going to help with bone density. B vitamins, the folate is going to be in there. B vitamins help with bone density as well. Then we have the supporting nutrients at the bottom here, the boron and the ipoflavone. So these two are really going to help with the rebuild. So the main difference between OsteoPrev and OsteoBase is now we're looking to rebuild the bone rather than just maintain. We need a little extra support to rebuild. So that's where you would go to OsteoPrev.
Now, Matt, I've been told that Michigan, and especially southeastern Michigan, is very selenium deficient in the soil, and that when we're eating vegetables out of our own gardens or things that are locally grown, we're not getting enough selenium in our diet. So this would be a good product to take. You probably have a standalone selenium product too, don't you?
We do, and it's involved with a lot of our multivitamins. I'm a big believer in multivitamins to get all these micronutrients, because nowadays lots of the soil, just your point on the soil is depleted just in general, and we're missing a lot of these of the trace minerals we normally get. We do have a selenium product, but we also have it in all of our multivitamin as well.
Got it.
Yep. A very good point, because a lot of the soil is dead nowadays, and that's where we're getting a lot of these deficiencies from. So we've got the osteopenia, we've got the foundational, but what about osteoporosis? Need the complete rebuild, and we need better bone. And this is where Pro Bono comes in. You can see the ingredient list is pretty long here, but this is your all-inclusive. It's your multivitamin, it's your bone building. This has everything in it that you'll need for bone rebuild. All your trace minerals, all your necessary vitamins. It's got the boron and the strontium in there. Strontium is going to be the main difference with the pro bono product. Strontium is really known to rebuild a lot of the bone. Lots of research has been done with strontium and the pharmaceutical option of bisphosphonates, and they place them head to head with a lot of the bone rebuild, and just the strontium is able to outperform bisphosphonates, which is the pharmaceutical option. So that just kind of proves that with the addition of everything we talked about with the K and the calcium, we can really help to rebuild that bone.
And Matt, would you take just a quick moment to
Yeah.
describe to our audience the difference between MCG, MG, and G?
Oh, sure, sure. So this is micro. So we'll start with the vitamin A on the top, micrograms. So this is just the concentration of how much a product. Certain products you don't need big concentrations of. So we have lost my pointer. Micrograms at the top with vitamin A, milligrams, which is a little bit bigger. Well, I guess a lot bit bigger than micrograms, and then in here G. So strontium at the bottom is in grams. So these are just concentrations from small, a little bigger than a little bigger. Certain things, certain nutrients you don't need very high concentrations of, and certain things you need a little bit more, of course. Does that answer the question, or?
Yep, that answers the question. Thank you.
Okay, no problem. All right, so bone summary. So what do I take when? So like we said, with the osteoporosis, pro bono, osteopenia, osteoprev, and you want to maintain your healthy bone, or you're getting close to osteopenia, your osteobase. And this will work in the reverse direction. So, I mean, osteobase is going to be good if you do have osteoporosis or osteopenia. They can all work upstream as well. It's never going to hurt. All those make sense, Dr. Shu?
Yep, all those make sense. Yep, and I think a lot of people are interested in that because some people may just have a concern, and some people may have a tendency to have osteoporosis, and some people may already be in it. So it's nice that you have 3 different products that
Yes.
handle all 3 of those situations.
Perfect. All right, so we talked about the bones, but maybe you're thinking, all right, my bones are fine, bone density is good, but I got bad joints. You hurt when you exercise, wake up, bad joints. Golfer's elbow, tennis elbow, things with physical activity, joint pain is not fun. So what can we do with that? Well, to start looking at the joints, there's a lot of connective tissues, tendons, ligaments, things of that nature, and lots of collagen with this. So 80 to 90% of the body's collagen is in type 1 and type 2. This will be important going forward. And we want to support all that connective tissue, the cartilage, and to help with the healthy joints. So what can we do with this? Collagen. So this is one of my favorite products that we do have. Collagen is kind of a lifesaver for 50 and over, as kind of the category of supplements. So what's the difference with our collagen? Because actually collagen is the #1 selling supplement on Amazon. So why would you use ours instead of the Amazon product? Well, there's lots of good points to that, but some of the main things are the way collagen is made. So collagen are into the peptide form. So peptides are really broken down proteins that are going to get into the joints, get into the connective tissue, or what you need to help with healthy joints. And there's 2 ways you can manufacture collagen, or to break down these peptides. One is with acid and bases. So it's acid-base hydrolysis. Dip it into the acid, dip it in the base, and you're going to break down into peptide form. Well, this process is not actually very good. So you want all your peptides to be the same size. Think of a peptide as beads on a chain. So we have a bunch of beads, and you got this long chain. Now we want to break down that chain into just individual beads. Well, if you use the acid base, you're going to take that chain and you're going to have one maybe this long, maybe one individual, maybe one medium size, no consistency. And this is going to hurt the absorption into whatever you're targeting, whatever joint it may be. The collagen that we use is used with a patented process. It's a company out of Spain called Bioiberica. This company, they patent a process for enzymatic digestion. So they take the peptide chain and they put it into a bath of enzymes. And what this does is break down those peptides into smaller beads, consistent beads, and the smallest we're able to get them. So this is a big part when we're looking at collagen, is we want the absorption. And so that's the starting point. And so the reason you see the Fortigel, Tendoactive, and the Mobily. So this is type 1 collagen, type 2 collagen, and the hyaluronic acid. Reason they have these special names is because of the company we work with and the patent and process. So they break these down, then they send us the raw material, then we put it into the collagen product. So we use their names on those. Another big thing. Do you have something, Dr. Shu?
Oh, I'm sorry, Matt. I didn't mean to interrupt you, but I
No,
think
you're good.
the audience to know that hyaluronic acid is what sometimes people have injected into their knees when the cartilage has
Yes.
worn away. Is that right?
Yes, correct. Very, very popular. But you can take it in a powder. Oh, another thing to mention is collagen is a powder. So you're taking this in a powder form. So to that point is these are all with the broken down with the enzymes, going to be in small form. And because it is a patented process, all of this has been used in clinical trial. Like I said earlier, we love clinical trials. And they've put all the stuff to the test with whether it's athletes, whether it's functional knee pain, joint pain in general, pain scales. This has all been put to trial, and we've had awesome success with it. Another thing about the collagen is it's a 1 scoop a day product, and it tastes awesome in your coffee. So a little fact about that: just putting it in your coffee in the morning, you won't taste a difference, and it's going to be very easy to remember to take your collagen.
Oh, that's pretty funny.
That's an ortho secret there. Then the last thing is the dosage. So when looking at collagen, there's actually a lot of research behind oxalate kidney stones and collagen, and that goes back to the dosing of your collagen. So when you get up to 10 to 20 grams, if a person has a long history of oxalate kidney stones, those higher dosing of the collagen is actually going to not be good for those individuals. It will actually support the forming of these kidney stones. So another big thing when looking at your collagen is the dosing. You don't want to overdose it. The reason some companies do put 10 to 20 grams is because it's not absorbed as well, and they do know that. So that's a very important thing to look at is the safety factor. That's not something you want to be worrying about when you're taking your collagen. So we are at about 6 grams. We're way under the research that would be related to the oxalate kidney stones. So that's another important factor behind that.
Now, Matt, you had mentioned a minute ago about the absorbability and that your collagen is more absorbable because of the
Yes.
patented process that it's made with. And one of the things that I have told our patients for decades is that the most expensive supplements you can take are the ones that you can't absorb, the ones that are passing through your system. And so much of what people take today is just passing through their system, and it's not being absorbed into the body. And one of the great things about the pharmaceutical grade supplements and orthos supplements in particular are that they're highly absorbable. Yes,
and that is the goal of what we're trying to do. We don't want all of our product just going down the toilet. So that's our collagen. So what else? You still got the joint pain. Osteoarthritis is a big part of this as well. And we have a couple other products that are going to help with this. Chondroflux and glucosamine, 2 awesome products for those chronic joint pains. So we start with Chondroflux. So this is a blend of glucosamine and the chondroitin sulfate. So, and we're going to talk about glucosamine as well. And these two products, we actually get it from the same company, BioBerica, because of the patent and process. We use them for these two products as well. And there's a reason for that. Just like the collagen, we're kind of targeting the same area of the joints. And when you're trying to get some into the joints, it's got to be very, very small particle size. And that company with the patent and process, we can't do it ourselves because obviously it's patented and we can't figure it out. So we partner with them to use these products to get them into the joints. So ChondroFlux is going to help with the cartilage and joint movement and kind of the lubrication there. It's got the glucosamine in there to support the joint. Chondroitin is going to help with the cartilage. Then a little bit of the bromelain in there as well with the inflammatory balance. So this is kind of for your chronic situation, something you're taking every single day for osteoarthritis, and something that works better with time. Then of course we have glucosamine sulfate, which is awesome product for, once again, the chronic situation. It doesn't have the difference here is it doesn't have the chondroitin in there. This is just going to be glucosamine, which tons of research with glucosamine and the osteoarthritis. This is going to help as well with the cartilage and joint integrity. That's really what we're looking at with the glucosamine. This is a product you're taking to take every day for a long time. Like I said, it works better with time, and it's going to help the joints over time.
Hey, Matt.
Yeah.
One of the most frequent questions we receive, between Dr. Alex and I, from our patients who we put on, we call it glucosamine. Apparently, I've been mispronouncing it all these years. But the glucosamine is whether they should take chondroitin with it or not. Can you tell our audience why you would take ChondroFlex versus glucosamine sulfate or vice versa?
Yeah. So, I mean, that's a good question because there isn't a big difference between them. So ChondroFlux is going to have a little additional support for osteoarthritis than the glucosamine sulfate, but basically you're going to pay for it. There's a little bit more in there. If you want a product you're taking every single day, glucosamine is going to be great. But if you want a little additional support and you're okay with paying a little bit more, you get the chondroitin in there as well. Both products are going to work great. Just the chondroitin is going to look a little bit more for cartilage support.
Well, and I think the other point here is too, and one of your scientists passed that information on to us, is many times when people have chronic joint pain and they need to take glucosamine, they've been taking over-the-counter pain relievers, aspirin, Tylenol, Motrin, Advil, and
Right.
I was told that those NSAIDs, those over-the-counter pain relievers, interfere with your body's ability to convert glucosamine into chondroitin. And so someone who's been taking those NSAIDs chronically needs to take the ChondroFlex because it has the chondroitin sulfate already in it.
Yes, that is a great point as well. That is totally true. Do you have anything else on those?
Nope, I'm good on those. Thank you.
Okay. So somewhere in those, kind of what we just talked about there. So what do I take when? Well, in the acute, the subacute injury recover, joint pain that's nagging or like a nagging pain that's always there, you can go with your collagen. Chronic joint pain. Oh, another thing on the collagen, which I know we're talking about joints, but it also is going to help with skin health, wrinkles, your hair and nails. It's kind of the beauty product side of it as well, because all that stuff has collagen in there. So you're giving yourself collagen support, you're going to help those areas as well. Chronic joint pain with the additional cartilage support, the ChondroFlux, chronic joint pain, long-term use, glucosamine. And another point is all these can be taken together. Maybe not the glucosamine and the ChondroFlux, because like we said, they have similar ingredients, but collagen and a ChondroFlux or glucosamine are going to pair awesome together. There's no issue in taking those together. Any other thing about, go ahead, sorry.
I just wanted to tell the audience, we have about 8 or 9 minutes left of your presentation, and then we're going to open it up for questions. So as people have questions, they can click on the raise their hand function on the bottom of their screen.
So real quick, I want to talk about kind of the immune health since we don't have a lot of time left. And so while we do not have a solution for specific viruses, say the coronavirus, we do have options to improve your immune health. And that's what it all comes back to, is your immune health. Your immune system is going to be what's attacking the virus. And I'm gonna go quickly through these since we're getting lower on time, but there's certain micronutrients that are going to help with your immune health, as well as botanical blends. And so where do we have this in? And this is our Viricid product. So this is really looking at your immune health and stimulating your immune response. So to start, we have vitamin A, vitamin C, B vitamins, and zinc to support the immune system. These are micronutrients that are going to stimulate your immune system and really help with the immune response. Then we have lysine, astragalus, elderberry, andrographis, and echinacea. These are botanical blends that are going to help with the immune response as well. And there's a couple different ways to take Viricid product. One is where you're just looking, you're getting into cold and flu season, you get sick. So you want to kind of want to help your immune system. You can take 2 a day just for proactively, just to help. The other way to take it is in the acute stage. So you get the tickle in the back of your throat, you're getting a runny nose, and you say, oh no, I'm getting sick. So what can I do? I don't want to see the onset of the symptoms. Well, if you get through 12 capsules of the Viricid in a day, we say 1 to 2 an hour, don't exceed that many an hour, don't take all 12 at once. 1 to 2 an hour, get through 12 capsules in a day, and you won't see the onset of the symptoms. And that once again goes back to the research with all these botanical blends, research looking at the onset of the symptoms. And if you give a mega dose right away in the acute stage, you're going to be able to cut down on the virus before you get to the symptoms. And we have those in the blister packs. That's the kind of the idea of the blister packs. There's 12 capsules in there. So if you think you're getting sick, get through a blister pack in a day, and you're good to go for the next couple days, or for the duration of the sickness. A couple other things you can use for your immune health. Of course, zinc. Zinc's really going to help with those immune cells, stimulates the immune cells. And I want to talk really, really quick because you may be thinking, well, I can get zinc anywhere. So zinc is, and these trace minerals, there's a lot that goes into the absorption of them. 2 different ways you can absorb trace minerals like zinc. One is by accident. So you take your zinc with your food, and your body's absorbing your food. Well, the zinc supplement that you take is gonna backpack on that food and get absorbed. Well, there's another way called the active absorption route, where your body's gonna look at the zinc and say, ooh, I want that, and absorb it, not by accident, I guess. And that is when we bind the zinc to an amino acid. So you see here, it's got the TRAX chelate. That's telling you this is another patented ingredient where the TRAX chelate is going to be bound to an amino acid. Your body absolutely loves amino acids, so we bind the zinc to that. So when it comes through the digestive system, your body's going to look at that, say, ooh, I love amino acids. Let's grab that, take that into the body. And now the zinc is in there with it. And then your body's going to break those apart. It knows what to do with amino acids. It knows what to do with zinc, and you get your absorption. So that's why very, very important to have a high quality zinc, and zinc that will actually be absorbed, like we talked about.
And Matt, would you also tell the audience why it's called reacted? What's that mean?
Yeah. So reacted is telling you that it's in the amino acid. It's bound to the amino acid. It's reacted zinc. So zinc reacted with the amino acid, and now they're bound together. So when you take them, your body absorbs it together.
And
so
isn't that process called chelation?
Chelation, yes.
Okay.
So when you look in the ingredient, we have the chelate.
And that's what makes it special, is the fact that it's chelated. Is that correct?
It's chelated. Yep.
Got it.
And so other companies, you'll see in retail as well, they will try to tell you they have a chelate product. The important thing to look for is this TRAX. So this is another patented process where we can't do it. It's a company called Albion Labs, they do it. And so that's a patented process. You can technically make a chelate, put a bunch of zinc in a bowl, put a bunch of amino acid in a bowl, stir it with a spoon, just based on the laws of chemistry. You will get a couple chelates in there just because it's going to happen. Maybe the pressure of the spoon is going to cause a chelate. And so companies will do that, put it in a product and call it a chelate. Well, it's not going to work like a true chelate where all the zinc is bound to amino acid. And look for the tracks. That's how you know it is done with the patented process. Another big thing is vitamin D. So like I said, vitamin D is good for, well, basically everything in the body, from immune health up to your bones. We have a few options for vitamin D. The 5,000 is most important. And why do we need so much vitamin D? Well, because we live up here in Michigan. We don't get the sunlight. Your main source of vitamin D is the sun hits your skin and it's turned into vitamin D3, and your body's going to use that D3. Well, we don't get enough of that in Michigan. Most people are deficient on vitamin D, so we need it in the supplement form. There's a lot I can say about vitamin D, but that's kind of the overview. And one of the most important things with your immune health is going to be the vitamin D. We'll go over that. Then I did want to talk about the fish oil. Do we have time?
Yes. Yep. Go ahead.
Okay. So fish oils are amazing. The standard American diet, not gonna lie, it's really, really bad. Basically one of the worst diets you can be on. And why is that? Well, one of the main reasons is your omega-6 ratio to your omega-3s. Ideally, in the perfect world, we want a 1-to-1 ratio with omega-6 to omega-3s. Typically, for the average person, we see 24-to-1 omega-6 to omega-3. So that makes it more. So omega-6s are going to lead to inflammation. It's going to cause issues with your circulation, could go to sleep, could go to acne. It can go to all different things. And so we need to supplement with the omega-3s. And that comes from the fish oil. Fish oils, there's a lot that goes into them. Big part is the freshness portion. So your industry average from, we call it catch to capsule. So all the stuff is actually coming from fish out of the sea. You catch the fish, squeeze them down, get all the oils out of there, go through distillation, get rid of all the protein, get rid of all the heavy metals, and you're left with the fish oil, and you put it in a capsule. Typically, the process for that with the industry average is 18 to 36 months that this fish oil is going to be processed and put in that capsule. That's pretty gross. That leaves lots of time for it to be oxidized, lots of time for it to go bad, and you're not going to get a good fish oil. We partner with a company out on the Chilean coast where we catch our fish up in Italy, and they catch and put it in a capsule all on one campus, all right there on the coast. Give it to us. We purify, make sure it's good, and we get it out to the patient. And this process typically takes 3 to 6 months. And you can actually taste the freshness of our product compared to whatever else it may be out there. So one thing we do like to do is I do have a bottle of omegas right here. If you take out a capsule, you can actually chew it, and you can see the oil in there. Kind of tastes like watered down Gatorade, and it's going to taste fresh. It's not going to taste like nasty fish. If it tastes like nasty fish, you do not have a good fish oil, and it's going to be oxidized. And that's why you get the burps and kind of the bad things you'll experience with fish oils. So if you do have a bottle, I challenge you to take one out, chew it up, and see what it tastes like. You'll actually see the freshness there.
Well, Matt, I'm not that brave. I like to swallow mine and not taste them.
I'm telling you, it tastes good. I challenge you.
In the process.
Then the other big thing is the triglyceride form. We talked about that earlier. A lot of what you'll see is the ethyl ester, which is basically the fatty acids bound to an ethanol. So when you take it into your body and you break that down, you have a toxin of this ethanol, and then you have the omegas, and that's going to hurt the absorption in the body. So we keep ours in the triglyceride form, going to help with absorption. And of course, like I said, with the taste, not going to get the burpy, not going to get the fishy taste, because shouldn't be there if you have a good fish oil, as well as the tested no heavy metals, no anything like that. We test it in-house, as well as we have a third-party company who helps testing with the fish oils, just to make sure we're always at top of our game, and these things are very pure. Then last thing, if we have time, is orthobiotic. This has been our top seller for 30 years. We feel we lead the industry with our probiotic. This is kind of the bread and butter, and there's certain reasons because of that. One's going to be the choice of the strains. We have research behind each of the strains that we choose to put in our product, whether it's the antibiotic resistance, the survival in the GI tract and through digestion, the pathogens it will bind to get rid of. And we picked kind of the most diverse options that we can. So this is a phylogenetic tree of bacteria strains, good bacteria strains that are good for consumption. And we try to pick from each of the arms of the tree. And so this helps. So we have a diverse area of these bacteria strains to help with all the different pH levels, as well as the different antibiotics. There's a lot more that goes into it, but that's kind of the high level of it. Then we also have two other options for probiotics. This is the 100 version and the 225. And what does this mean? This is just the amount of the bacteria that's in there. So the 100. So this is all looking at the gut health. So for shield situations, so that kind of means not totally need a rebuild of the gut, but you are need a little extra support than just standard orthobiotic. Then we have the 225, which is going to be rapid immune support. So this is going to really help with the rebuild of the gut and the microbiome. Just a much higher concentration of the bacteria in there.
That's great.
So who can take a probiotic? I think this is an everybody product. This is something I take every day. Microbiome is kind of a big deal. Make your microbiome happy. You're going to be a happy person. Poor diet, antibiotic use, environmental factors, stress. All these things have they have an impact on the microbiome, and this is going to hurt with your nutrient absorption and GI issues. So this is something that you can take daily just to keep up on the microbiome and make your microbiome happy.
Now, Matt, what I do is I don't find a need to take the orthobiotic every day, but I have a box of the 225 in my cupboard. And when I come home from traveling, I take it for 3 days in a row, and it straightens things right back out. Because when you're traveling, you're eating different foods, you're in different areas, stress and so forth. And I find it really makes a big difference.
That is wonderful. Yep. Especially with the 225, that's not something you want to take daily anyways.
Right.
So,
right.
Yeah.
All right, we just about ready to close up on the presentation portion, Matt, or you have anything?
Yeah, no, we're all set.
Well, we do have a question.
Sure.
This is a question says, my doctor has told me I'm at risk of osteoporosis. I've had trouble with another company's pharmaceutical grade calcium causing fairly severe abdominal pain. Dr. Shu recommended reacted calcium, which has not been causing the same pain. Is this a sufficient supplement for warding off osteoporosis?
So it's going to help, but you could have some additional support as well. So like we talked about with the vitamin K, the vitamin D, there's other things that's going to help the calcium as well. Just calcium, it's not going to hurt you, and it's going to be good, but there is additional things that you could do with like the pro bono or the osteoprev.
So for someone who's at risk for osteoporosis, doesn't have it, but is at risk, that middle level would probably be good?
The osteoprev, yes.
The osteoprev? Okay.
Yes.
And that's got the reactive calcium in it, correct?
Exactly. And I bet the reason you were having abdominal pain is because it is reactive calcium. It's got the amino acid, and it's going to absorb better. That maybe the version you were taking wasn't absorbing well, wasn't getting into the body, and it's going to give you an upset stomach. So when it can't get absorbed, it just sits in the GI tract, and not very fun.
Good. Well, before we get any more questions, I want to kind of recap what we've talked about. This is an excellent presentation, Matt. Really appreciate it. You talked about why quality matters. You talked about that your company uses patented processes whenever possible to make sure that things are as absorbable as possible. We talked about the 3 levels of bone support, joint health, viral support. I love those little blister packs for the Virusid. I think
Good.
I'm going to make sure that each of my staff has those. So should they
Awesome.
start to feel something, they can hit it right away. I think those are great. And we talked about digestive help here at the end. Until we get another, I see another question has come up. I see, I've been taking your product Adrenavive and Cardio B for cardiac and adrenal support. And I found
Yep.
out many years ago, in fact, your boss Nate is the one that told me that, you know, by the time you're 50, you've burned through your adrenal glands and you're running on empty, and it's good to take adrenal support. And I know that helps me a lot with anxiety. I'm
Correct.
prone to anxiety when I get run down, and I just feel so much better when I take it. Are there any products that you have that would be good in addition to those for anxiety, or maybe if people had a mild level of depression?
Yeah. So just to start with what you're doing with the B vitamins as well as the adrenal support, that's kind of the basis where to start with the anxiety and depression. Typically, that comes from long-term stress or dysfunctions with some of the hormones that causes. And so the starting point is going to be the B vitamins as well as the adrenal support, because once your hormones get off, your adrenals get off, and that's where we get some of the anxiety and depression coming from. So that's going to be the starting point. The other thing you can do to help is with neurotransmitters, a product called Cerevive, as well as the Adrenavive, and a Cardio B, or just a good B complex is going to work for that as well.
Got it. Well,
Yeah.
that's good. Thank you. I've got another question. It says, can you mix the collagen with other liquids, or should you stick with water? I thought you said we can put it in our coffee, right?
Oh yeah, you can do. You can mix that with anything. It should be pretty tasteless. We've done a lot has gone into that to make sure it tastes good. Just the most common is putting it in coffee, and you can't taste anything, but you can use anything you want, whatever tastes
And I
good for you.
mix it with my other powdered vitamins as well. I just try to
Yep.
stay away from anything that's carbonated. That tends to cause problems. But if it's
Makes
if
sense,
it's
yeah.
a juice, you know, orange juice or grapefruit juice, I think any liquid works fine with that. I just mix
Smoothies
mine.
work great too.
Pardon me?
Smoothies work great too if you mix it in a smoothie.
Yeah, but probably not Diet Coke, right? You wouldn't want to mix it with
And
Diet Coke.
I wouldn't recommend Diet Coke. Wouldn't recommend drinking Diet Coke too often.
All right, well, your next question is, I've been diagnosed with osteopenia. I am curious
Okay.
about the clinical trials on the Osteoprev product. Did trials include bone scans that showed new bone growth with use of this product?
Yeah. Well, so most of the bone scans have come from the pro bono. So even if you're in the osteopenia stage, pro bono is still an awesome product, and that's what we've seen. The actual data with bone growth was off of the pro bono product. The Osteoprev, not the product overall, but we've seen bone growth with some of the individual ingredients that we use to compile to make that product, if that makes sense.
And I would agree with that too, Matt. We've recommended Pro Bono for a number of years. You've had that product for quite a while.
Yeah.
It's nice to see that you've got the lesser levels now, but once you've gotten into that osteopenia stage, I agree with you that Pro Bono is the way to go. And that's the one that's
Yes.
been proven, right?
Yep.
The other ones are just for support if you have concerns.
Yep.
Yep.
So Pro Bono is also going to work as your multivitamin. So you don't have to take a multivitamin with it. You really don't need anything else unless you're getting into like the adrenals and things like that. But the Pro Bono's got absolutely everything in it. So
that's
all in one
awesome.
product.
That's awesome. Let me see. Do I have another question? Yep, I do have another question. Hang on. Do you own your own clinical trials, or are you relying on trials done by your vendors?
So we do not own our own. What we do is just take, and it's not even the vendors that we use. This could be absolutely anything. Typically, the raw ingredients that are used in the trial, we're able to have access to. So a couple of things that we have are proprietary to only us with the vitamin K, things with our immunoglobulins. So those are certain things that are done by our vendors, but we use any research we can find on that raw material, because tons of people are doing this research, and you can find it all over the place.
Great. That is really good. And I wanted to tell everyone too that we've been using a new company called FullScript for about a year, and it came out just in time with all the closures from the pandemic. And FullScript carries the full line of Ortho Molecular products that you can order from your home. And Sarah has sent me a note here that says anybody who was on the webinar today will receive 20% off of their next FullScript order, and she will set that up for you. If you have any questions, you can talk to Sarah directly. But Matt, I want to thank you sincerely for taking the time on a Saturday to present. You've done a great job. I know many of your presentations are to the doctors, but I think you've done a great job to make this a good seminar for the layperson. And any questions that anybody has, we can pass on to Matt, and Matt's always quick to respond to us. So with that said, we've made a recording of this webinar today, and we'll be editing it and putting it on our website so people can go back to it, or people who couldn't be here today can access it. And again, thank you, Matt, and thank you, Ortho Molecular. Have a great day, everybody.
No problem. Thank you, Dr. Shu. And thank you, everybody, for attending.